So, yes, I'm Dr. Jo Jorgensen. I teach at Clemson University in South Carolina. However, I grew up north of Chicago, so I am a Midwestern girl. And I'm running for president because government is too big, too bossy, too nosy, too intrusive. And worst of all, it usually hurts those it intends to help.
That there's a whole system at the state level, at the federal level, that stops third party candidates from really gaining traction, from really building momentum. And I think it's important for us to ask this: what kind of challenges has your campaign specifically been dealing with so that you are on the ballot and maybe get a chance to maybe debate the two presidential candidates? I mean, I know at this point there's a system put in place, but what are some of the challenges that you specifically and your campaign are dealing with right now for this general election cycle?
Well, first of all, I would like to point out that what sets us apart from the other third parties, such as the Green Party, is we are the only political party other than the Democrats and Republicans who've been on the ballot in all 50 states in back to back elections. And in fact, it was after we were gaining popularity and we were on the ballot in all 50 states that the states started to say, you know what? Word's getting out there. We got to do something about it. And so then they put up some horrendous ballot access laws. And what's ironic is that our federal government looks around the world and they point to other countries and they say they don't have free or fair elections. And yet we have this going on in our own country. So we are doing very well. I think we're up to 44 states by now. And we do expect to be on the ballot in all 50 states. Again, the Libertarian Party has set themselves apart from the other parties in that, and we are offering the only true alternative
Hmm.
to what we have of the two, like you said, the two old parties that just aren't responsive.
Now, I've interviewed some of your opponents who are running for the nomination, as well as Green Party candidates who are running for their own respective nomination as well. And I asked them this question, and I think it's only fair enough that I ask you because now you're the nominee. But what are you hoping to do in regards to building power, effective power, so that in future election cycles, the Libertarian Party still keeps on gaining momentum and much more of a larger following? What are you about to do to really make sure that Libertarian has a much more larger standing point in American politics?
Well, first of all, I usually don't like the word power. So what I would say is we want to give as many people the option to have a decision other than the two old parties. And we keep hearing the media talking about two old rich white men and how they don't really differ that much. And if you look at it, they both want bigger government. They both want to make decisions for you, both in your personal lives and with your money. And we're the only ones who are saying that you deserve to run your life how you would like. You deserve, you can spend your money much better than the bureaucrats in Washington, and you should be able to make your own decisions.
So, okay, so I'm very glad you're at least asking, at least bringing that up in regards towards the future of third parties, because I think, like, at least from my own perspective, my point of view is that the third parties, there should be more choices, and effectively, yes, while you don't like the phrase power, there should be at least people that have the power of choice, so that they can have maybe another alternative besides a Democrat or Republican choice, which is something that we've been dealing with for years. So let's switch things up again and really start talking about policy. So right now there's a lot of support for universal basic income. This was basically, adopted by Andrew Yang during the Democratic primary process. Tulsi Gabbard then carried it forward. What is your perspective on UBI? Are you for it, and how would you help implement it if you are for it?
Yeah, I'm completely against it because once again, we're sending our money to Washington and let them decide. Research has shown very clearly that if money is put in the hands of the private sector, they create twice as many jobs as the government when they have the same amount of money. So rather than having people send their money to Washington and have them take a cut out of it and spend it again on their special interests and lobbyists and then send it back to people, why not have the people directly spend that money? Why not have the people directly decide, I want to support that company, I want to support this small business in town, or this is where I want my funds to go, is here as opposed to somewhere else?
Mm. But in regards to looking at a country like Canada, for example, they have a temporary UBI, and a lot of their citizens have been seeing that it's been helping them out go forward, especially maintaining that they still have a household, because we still have this problem with people right now being at risk of being evicted from their apartments and homes, and that's a real serious situation. And with unemployment right now, 50 million Americans on it, a lot of people are warming up to the idea of a UBI, being implemented here in this country, or at least maybe potentially a temporary UBI.
Oh, it's a serious problem. And look who caused it. It was the government politicians that caused it. So when they want to hand out a UBI, basically basically government breaks your leg and then government says, oh, aren't you grateful? I'm giving you a crutch. How about having government not break our legs? How about not putting us all under house arrest where we lose tens of millions of jobs? How about letting us make our own decisions? And how about getting rid of the obstacle of the FDA so that we get more testing so that we can have people go out. A lot of people don't realize that there were over 60 companies, American companies, coming up with testing kits. However, the FDA only approved 2 of them. They were an obstacle to getting those approved. And so where did those testing kits go? They went all over the rest of the world. And we kept hearing about how Southeast Asia was doing a good job containing the virus because they were testing everyone. Yeah, they were testing them with our kits because we weren't allowed to buy them. So how about government not get in the way to begin with, and then we don't need them to give us a crutch after they break our legs?
Okay, I'm pretty sure there's a lot of other data that's showing UBI being effectively being used, as well as giving relief to the people. But if we're going to be talking about COVID-19, let's also address this fact that. Yeah, go ahead.
Do you mind? You mentioned about the UBI helping people.
Yes.
Do you mind if I expand on that a little bit?
Go ahead, please.
Because you're right. I did go into coronavirus because there's just so much that the government has done wrong. But basically, what the UBI is doing is it is giving help to those who need it, right? Mm-hmm. Who are in dire need of help. So we do want to help people. The question is, what's the best way to get that help to the people who need it? How do we get the dollars from the people who have it mm-hmm. to the people who need it? And what I would suggest is that the federal government does not do a good job. And let me mention 2 things. First of all, with a case I like to point to is back in the early 90s. The United Way president, CEO, bought something like $400,000 worth of artwork, which in today's dollars, by the way, would be worth about $1 million. And what happened was donations dried up. People said, you know what? We don't want our money spent on our artwork. We want our money spent on going to help people. And so the United Way had to work really hard to gain their trust, to show them that, yes, we are doing good with your money. Now, what if that same money had gone to the US government and there was high overhead and people, again, giving it to their buddies? There's no accountability. There's no way for people to say, you're not doing a good job, you're not getting it to those in need. And so there's no accountability. Now, a second thing I'd like to mention is let's say you inherited $10,000. And you're looking around, you're doing okay yourself, and so you don't need the 10,000. You figure, what the heck? I'll donate it to those in need. So first of all, maybe you look at your local churches. Maybe they can help out. Maybe I can give them $10,000 to give it to the needy. Or maybe you look at a private charity. When looking at the places to give your money to do the best good, would you say, you know what? I think I'll give it to a federal government program. And most people laugh at the thought because the government does not do a good job of basically doing anything. And even if you look at Oprah Winfrey and Bill and Melinda Gates, instead of turning their money over to the federal government, they started their own charities because they know that they can do a better job than the government. I would much rather turn my money over to Bill and Melinda Gates and let them help out people than to give it to the government.
So your reservations towards the UBI is more of you're concerned how the government would implement it and how we would distribute it towards the people.
Well, I mean, there's a moral implication behind that too, and the fact that you're taking the joy of giving away from people. I teach psychology, and one of the things that I really don't like is when I hear about, for instance, high schools who have mandatory volunteer work. And okay, if it's mandatory, it's not volunteering. And then what happens is kids go to the soup kitchens or whatever, and they say, well, this sucks. And they don't get the true sense of giving, the joy of giving. So what we have, instead of person helping person, of us helping our fellow man and getting the joy of that, basically the government takes our money, whether we like it or not, in whatever they think they need, And then a faceless bureaucrat hands it out to people who perhaps don't feel obligated to, maybe I should get out there and look for a job. And if you look at uh, stats from not only the United States, but Denmark and other countries around the world, if they shorten the amount of time that they're getting government welfare, then people get jobs sooner. So, as I say, necessity is the mother of invention, and we find that's the case in charity. But absolutely, some people need true help. I'm just saying that the government is not the best place to do it.
All right, and now let's switch things up in regards to COVID-19, because it's something that everyone's going to have to be addressing. It's clearly impacted the entire planet, not just the United States. And but here in the United States, right now we're number one in regards to having the most cases, most deaths. We have a system that was never really prepared for it. So in regards to COVID-19 and our healthcare situation, what is your proposal in regards to healthcare here in the United States? Because here we're seeing Americans walking out of the hospital with, at the bare minimum, a $100,000 bill from the hospital, or at max maybe $1 million. And no one currently right now, with 50 million Americans on unemployment, no one has that kind of money to pay it off. So what is your version of healthcare here in the United States? We know that Trump and Biden are not on board for Medicare for all, but we're seeing a lot of people who are on board on Medicare for all or single-payer healthcare. So what is your policy on healthcare here in the United States, as well as dealing with this COVID-19 crisis that we are currently dealing with?
Yep. So with regard to healthcare, if there is one message I could get to every American in this country, it would be that we do not have a free market system, because we've heard other politicians say, well, it looks like the free market doesn't work, so we're going to have to go to single payer system. We have not had a free market system since at least World War II. And if you look within the United States at the two specialties that are most free market, which would be cosmetic surgery and LASIK, because the insurance companies do not pay for those, people have to pay for their own dollars, with their own dollars for those services. What you'll see is prices have gone down dramatically and quality has gone up. And why is that? Because the doctors have to compete. They have to compete with each other on price and quality to get the patients what they, so that basically they get the business from the patients. When you go to buy a car, you've got one dealership vying for your business with another dealership. Maybe you're looking online, but you're looking for the best price and the best quality. And in order to get your business, that's what they have to do. They have to compete. Same with buying a computer, buying groceries, buying gasoline, anything like that. So what we need in healthcare is we need people competing, trying to offer us lower prices. And there's one country that's done a pretty good job of basically putting people in charge of their own healthcare dollars, which means that doctors have to compete, and that would be Singapore. And prices are something like 75% less. For instance, a heart bypass in our country costs about $130,000. Average heart bypass there is only $18,000. That's still a lot of money, but that's what people spend on a car. So, and I'd like to mention quickly, I don't say the doctors are the villains here. The problem is we've got government bureaucracy, and a lot of doctors have even said that they just don't like practicing medicine anymore because they're so, because of the insurance quagmire.
But I think it's also imperative to bring up the fact that single-payer healthcare and Medicare for all is gaining a lot of traction. It has a lot of support from a lot of people here, especially those from the Bernie Sanders camp, but also there are a lot of independents, and also, yes, in some cases, some Republicans and Libertarians that are also on board for Medicare for all. Would you be in support of implementing any kind of single-payer healthcare system, or at least adopting certain policies from it for your campaign?
Oh, absolutely not, because you don't have doctors competing. When I hear single payer system, when I hear Medicare for all, what I hear is VA hospital for all. And we all saw how well the VA hospital did for our country. And also, if we look at single payer systems such as Canada and UK, what we see are very long waiting lines. And for instance, in England, doctors get bonuses for not referring their patients to specialists because the system is so broken, they don't have the money to pay for specialists. And people often die while they're waiting for treatment, or they simply give up. So there's in a single payer system, what you've got is a monopoly. And most people do not like monopolies, and they realize it doesn't work with big corporations, and it certainly doesn't work with the federal government.
that's going to be a hard sell, especially for a lot of people who are seeing with this COVID-19, especially those who are saying like Medicare for all is needed. But that is your perspective and your
Oh,
policy, and obviously you are running on that. But go ahead.
yeah. Well,
Let's
what I was
finish it.
trying to mention is we don't have a free market system right now with doctors competing. So we can't just simply yank the rug out and expect people to be able to afford their own health care. We can't, because the government has been in it too long. It's the government being involved that has raised the prices. So what they do in Singapore, and what I would be in favor of, is as an interim step, would be to actually put the healthcare dollars in accounts for people. Here are your whatever $1,000, you go out and spend them, and then have the doctors starting to compete. So absolutely, we can't immediately just put everybody out on their own. That's not the way to do it.
All right, I will let you have that. And that question was that comment. And then in regards to this is like the final question. It's a two-part question. We are seeing right now that there are 3 debates that are set in for Joe Biden and Trump to basically debate each other. So we here at Heartlands Media would like to offer this alternative. If it is possible, would you be open for a third-party debate that would be moderated by us with you as well as any other independent candidate that is currently running in this election cycle? Would you be on board for that?
Well, we haven't talked about it yet, but I can tell you, if either Donald Trump or Joe Biden would be on it, absolutely, I would be there. It doesn't even have to be both of them. Just one of them would be fine.
All right, and then finally, in regards towards your campaign, if people want to learn more about your campaign, find you online on social media, where can they go?
Thank you. I appreciate that. It's joj2020.com. Again, joj2020.com. And I'd like to mention really quickly, it looks like well over half of our volunteers are people from outside the party who are looking for an alternative. So we're really excited about the momentum we're gaining.
All right. Well, thank you so much, Dr. Jo Jorgensen, for joining us here. I'm Kit Cabello, the host of Heartlands Media. Peace to you guys, and let us all do what we can to build a better future.